In 1988, the University of Nebraska Medical Center received a new machine to help babies with breathing issues. The process was new to doctors and to patients, and it was very risky, but it saved lives. In 1989, I was the 18th baby on the ECMO machine here at the University of Nebraska Medical Center. My story is still remembered by many today, and this is my story.
I can remember getting the call on December the 18th, 1989. I was working at the Logan View School, and they told me I had a new grandson. I was looking at the baby, and I kind of was troubled because I thought, his coloring isn't normal. It looks blue. And I looked over at the nurse, and she was standing directly across from me, and I didn't want to scare Suze, and we had eye contact, and that's when I realized, and I know she realized, that there was something that wasn't right.
Okay, Taylor, when you were first born, the blood vessels in your body did not contract and stay open. The ones in your lungs, they just closed down. The minute you were born and outside, you just did not want to breathe on your own. They let me hold you for just a couple seconds, and then they took you out of my arms and away they went. I was scared to death. And right away I asked the doctor, I said to him, is my baby going to die? And he grabbed my hand and looked and said, Susie, I don't know. We need to get him baptized now.
This is me 1 year after being taken off the ECMO machine, a happy and healthy child. For Star City News, I'm Taylor Dahl reporting. With technology and medical procedures changing for ECMO and persistent pulmonary hypertension, children no longer have to have their jugular vein removed and carotid artery like I did. Since I had my jugular vein and carotid artery removed, I now have to wear this medical alert bracelet to show paramedics in case I'm in an accident that I have no jugular vein and no pulse on my right side.
So we elected to put you on bypass to let you recover from that. We made those decisions based on mortality tables that told us you were at a 70 to 80% risk of dying from your disease. So, and the disease is something that was self-limited, would go away with the proper amount of rest. So we made the decision to put you on ECMO, which was a big deal because we'd only been doing it for about a year and a half at the time. The method we used in Taylor is just to do the artery and vein in the neck. It's less risky than open up the whole chest to do it and allows you to go longer.
Linda Pfeiffer has been a registered nurse and ECMO expert at the University of Nebraska Medical Center for more than 20 years.
What has changed over the years since Taylor was a baby is the introduction of the nitrous oxide, which seems to relax the pulmonary bed so that the hypertension, the pulmonary, the PPHN dissipates, and so that allows more blood to actually go through the lungs. So his lungs can do the job they're supposed to. Usually the lungs are not sick, but the circulation for some reason is not, the pressure is still high.
We were getting ready to bring Taylor home. You said, now Scott and Susie, there's nothing wrong with this little boy. He's a normal, healthy little boy. Go home and tell everybody that.
ECMO was revolutionary, and I now know how important my case was to the University of Nebraska Medical Center. For Star City News, I'm Taylor Dahl reporting.
I knew you were a perfect candidate for this because there was nothing else wrong. Your kidneys were fine, your liver was fine, your heart was fine, everything else was fine. It was just your lungs weren't developed.
Being 22 years old now, and always hearing as a child that you can't do what all the other kids can, was motivation for me. And that's why I try to run as much as I can.
When Taylor first told me about his condition when he was younger, I was surprised because you can't tell at all by what he's able to do or by how he acts that he had this condition when he was younger. Like when we go play football or go skateboard, he's hanging in there with the rest of us, and you would never know that he had this condition. I think that Taylor having the medical bracelet is a really good idea because you can't really tell just by looking at him that anything was ever wrong with him. So it's great to have that just in case of an emergency when he would need to get his pulse checked or need medical attention, and you really wouldn't know without looking at that bracelet that he doesn't have a pulse on his right side or a carotid artery.
You were such a tiny little thing, and you were so sick. But to see you then and to see you a week later, you were so much improved. And then to see you now, how you've really grown into such a nice big man and such a wonderful person, that we're just thankful that everything turned out the way it was supposed to.
When an infant is born with a breathing problem, it's really just a lifelong battle to stay healthy, and you don't take breathing for granted. For Star City News, I'm Taylor Dahl reporting.